Welcome to this presentation of motivational interviewing.
Motivational interviewing attempts to ignite behavioral change through collaborative communication. Motivational interviewing can be integrated into practice to improve the conversation between the clinician and the client. Motivational interviewing can motivate people to make a positive behavior change. This approach is specifically effective for clients that have mixed feelings about changing their behavior.
Components of OARS: open-ended questions, reflective listening, affirmation, and summarizing.
Comprehensive look.
To better understand how motivational interviewing works, let's look at the self-determination theory. It states that we are more likely to change if three basic psychological needs are addressed.
Autonomy in making decisions, mastery and a sense of our competence in making the change, relatedness and a sense of being supported by key people around us, including healthcare professionals.
Motivational interviewing questions and skills.
Motivational interviewing aims to encourage the client to become an active participant in the change process by evoking their intrinsic motivations for change.
Clients may have uncertainty, and it may seem like resistance. This is considered a normal part of the change process.
Evoking is central to motivational interviewing, but it is also most challenging to master as it is vastly different from traditional advice giving.
Motivational interviewing requires 4 key communication skills that support and strengthen the process of eliciting change talk, also known as OARS.
Open-ended questions, reflective listening, affirming, summarizing.
Open-ended questions help find out more about the client's perspective and ideas about change. They are also crucial in building and strengthening a collaborative relationship. Useful in the process of evoking the client's motivations for change.
Affirming, recognizing and commenting on the patient's strengths and abilities. Excellent for building rapport and can increase it by using some of the well-known coaching techniques by incorporating acknowledging and validating clients' emotions.
Reflective listening. Employed effectively through summarizing. Repeat what the client has told us in our own words and in the form of a statement rather than a question. Build engagement with the client, particularly when he or she is upset or angry, as it can help them to calm down and feel understood.
Summarizing. Used for collection of reflections. Allows the practitioner and the client to identify the core ideas of the client's story. Combining reflective listening with effective summarizing allows the clients to hear themselves talk about change.
Change talk. When the client makes statements that are in favor of change, it signals that the client is more willing, able, or ready to make the change.
The clinician's role is to elicit change talk from the client in a collaborative fashion and avoid imposing it.
Remember, motivational interviewing is a consensual, negotiated process between the counselor and client.
Change talk can occur in several forms and is exemplified by a statement that indicates the desire for, the ability to, the reasons for, and the need to change.
Desire statements indicating a desire to make a change. An example statement might be, "Getting in shape would make me feel so much better about myself."
Ability statements speak to the client's self-efficacy or belief in the ability to make changes. An example statement may be, "I think with some help, I might be able to cut back."
Reason statements reflect the reasons the client gives for considering a change. The client may say, "I have to quit smoking because of my asthma."
Need statements indicate a need for change where the emphasis is more emotional than in the case of reasons statements, which are more cognitive and rational. The client may say, "Something has to change, or my marriage will fall apart."
The most important aspect of motivational interviewing is for the practitioner to recognize and then emphasize change talk and pay particular attention to commitment language.
When the client uses verbs that express authentic and robust commitment to change, this presents an opportunity to get them to elaborate further and strengthen the commitment level.
Tips to elicit change talk. The clinician can use evocative questions that are targeted to the client's current level of motivation.
The clinician can ask the client questions about factors that might impact change when the client is uncertain about his or her capacity to change.
The clinician explores current readiness for change by combining rating scales and open-ended follow-up questions, reflecting the client's arguments for change, optimism, and self-efficacy.
Readiness for change and motivation. What people say about change predicts subsequent behavior. It reflects motivation for and commitment to change. When clients make arguments against change, also referred to as exhibiting resistance, it produces less change.
The stages of change model of Prochaska. Trans-theoretical model of change.
Pre-contemplation. In this stage, a client may say, "I don't need to change." Critical markers: reluctant, rebellious, resigned, rationalizing.
Reasons for resistance to change. Reluctance. The client is unwilling to consider change, comfortable and averse to taking a risk, unaware of consequences. Rebellion. Client can be resistant to change because they value their independence. Resignation. Client feels helpless and overwhelmed by problems and feels like a failure. Rationalizing. Client employs rationalization as a form of protection, unlike rebellion, more about thoughts than emotions.
Contemplation. Client may state, "I don't need to change." Critical markers. Ambivalence.
Contemplation stage. The client is thinking about the change but is ambivalent while weighing and examining the benefits of and obstacles to change. Some clients will find themselves in this stage for prolonged periods, experiencing stress as they feel stuck.
Preparation stage. Common phrases include, "I will change, but..." Critical markers. Procrastination.
Preparation stage. Clients will see change as important and view themselves capable of change, but will often make yes, but statements and put off taking steps toward change. They will usually find themselves having experimented with changing the desired behavior, seeking support, identifying barriers, and resources.
Action stage. You may hear a client say, "I am changing." Critical markers. Behavioral steps.
Action stage. Change is visible and equated with progress. Alterations in awareness, thought processes, emotions, and self-image occur as client exhibits diligence and puts a lot of effort into the process. Most clients will experience setbacks and periodically resume the old behavior at this stage, which may halt the change process, make them feel demoralized over occasional slips, and can sometimes result in the client giving up. These are normal and a part of this stage and are not seen as failure or relapse.
Maintenance stage. A common phrase may be, I have changed. Critical markers. Commitment.
Maintenance stage. The client has successfully made the change in behavior and accomplished the goals he set for himself, usually after 6 months. Clients can become complacent, and onsets of negative circumstances can influence the commitment and threaten the sustained, long-term effort if no maintenance strategy is developed.
Markers of readiness for change. Willingness to change. Ability to make the desired change. Readiness to take action to make the change.
Now it's time to take a quick evaluation. Take out your phones and scan the QR code. Take this quick 10-question evaluation. After the evaluation, we will discuss and answer any questions about motivational interviewing.